Hello everyone, the topic of today's discussion is histology of non-keratinized mucosa. In the earlier discussion, we have discussed that the oral cavity is lined by stratified squamous epithelium, which can be keratinized or non-keratinized based on its functional adaptation. So in the keratinized epithelium, we further have subclassification as parakeratinized and orthokeratinized based on the presence or the absence of nuclei respectively. So today we'll be discussing non-keratinized epithelium. So we'll be revising the classification once again. The oral mucosa is being classified based on their functional adaptation into masticatory mucosa, the mucosa which bears the masticatory load, which comprises of gingiva and hard palate. Second is the lining mucosa, because the oral cavity provide a moisture lining by the mucosa, and it comprises of soft palate, ventral surface of tongue, floor of mouth, alveolar mucosa, labial or buccal mucosa, and the vestibular fornix. Also, there is a specialized mucosa which provide sensation against the taste and the pressure and pain sensations, and this is comprised of dorsal surface of tongue. So based on the functional adaptation, the mucosa can be classified as masticatory mucosa, lining mucosa, and based on the sensation activity, it is classified into specialized mucosa. So majority of the oral cavity is lined by the lining mucosa, followed by the masticatory mucosa, and then the specialized mucosa. Also based on their keratinization pattern, the mucosa is subclassified into keratinized and non-keratinized. So when we talk about the based on their function, about 25% of the oral cavity is lined by the masticatory mucosa, and this mucosa is hard, it is resilient, and it is bound directly to the bone with the help of mucoperiosteum. Either there is no submucosa in between, or it is very minimal, and it does not stretch, and it is seen in cases of gingiva and hard palate. When we talk about the lining mucosa, it is non-keratinized stratified squamous in nature, and in the oral cavity, except the gingiva and the hard palate, all the structures are lined by the lining mucosa. It is soft, it is flexible, it provides the movement of contraction and relaxation to the cheeks, lip, tongue, and also for the movements of mandible. When we talk about the area of the coverage, the maximum area of the oral cavity is bounded, about 60% of the area is bounded by the lining mucosa. When we talk about the lining mucosa, we have lip, the buccal mucosa, the vestibular fornix, the alveolar mucosa, floor of the mouth, and in the soft palate. Now, starting with the non-keratinized epithelium, the non-keratinized epithelial cells in the superficial layer do not have keratin filaments. That is why they are known as non-keratinized. The surface layer cells also have nuclei, whereas in cases of keratinized epithelium, in the orthokeratinized, there was absence of nuclei, and in cases of parakeratinized, there was shrunken or pycnotic nuclei. The epithelium is associated with the lining of the oral cavity. Now, coming to find the differences between the keratinized and the non-keratinized epithelium, we have to keep in mind that the keratinized epithelium is made up of four basic layers: the stratum basale or the basal layer, stratum spinosum or the spinous or the prickle cell layer, stratum granulosum, that is the granular layer which comprises of keratohyalin granules, followed by stratum corneum, that is a cornified layer which shows keratin squames. Whereas when we see the non-keratinized stratified squamous epithelium, there are three layers: the stratum basale, stratum intermediate, and stratum superficial, that is the surface layer. When we see the keratinized epithelium, there is a cornified surface layer, whereas in cases of non-keratinized, there is no cornified layer. Also, the keratinized epithelium shows prickly appearance in the stratum spinosum layer, whereas in cases of non-keratinized epithelium, the intercellular spaces are not that obvious. Therefore, the prickly appearance of the spinous layer is not that evident in cases of non-keratinized epithelium. When we talk about the nucleus in the superficial layer, in cases of keratinized epithelium, when we talk about the parakeratinized, P for parakeratinized, P for pycnotic. Therefore, you have to remember with this mnemonic that the parakeratinized epithelium will have pycnotic or shrunken nuclei, whereas orthokeratinized will have no nuclei. But when we talk about non-keratinized epithelium, there is presence of nucleated cells in the superficial layer. The keratinized epithelium comprises of filaggrin protein, whereas in cases of non-keratinized, filaggrin is not there, it is involucrin which is there. When we talk about the presence of tonofilaments and keratohyalin granules, it is seen in cases of your keratinized epithelium in the granular layer, whereas it is less developed and there are no keratohyalin granules in cases of non-keratinized epithelium. So now starting with the non-keratinized epithelium, they are usually present in lips, cheeks, alveolar mucosa, soft palate, ventral surface of tongue, and floor of mouth. When we talk about the layer, there is the basal layer, that is stratum basale, which resemble to that of the layer in the keratinized epithelium. Then the second layer is the prickle cell layer or stratum spinosum, which consists of cells that are large in keratinized epithelium. And also there was prominent intercellular bridges and the spaces, which is less evident in cases of non-keratinized epithelium. The intermediate cell layer or the stratum intermedium is comprised of flattened cells, followed by the superficial layer, which is also known as stratum superficial, which has cells which are slightly flat, but they have nuclei, whereas in cases of keratinized epithelium, either there are no nuclei or they are shrunk. There is no clear demarcation when we talk about stratum intermedium and stratum superficial, and stratum granulosum is absent in cases of keratinized epithelium. So you can very well appreciate in this histopathological diagram that the non-keratinized epithelium is comprised of the basal cell layer or stratum basale. Then there is prickle cell layer, which is not that obvious as that of keratinized epithelium, followed by stratum intermedium layer, and then stratum superficial. So there is no surface keratin, and there is no absence of nuclei in the superficial layer. So now coming on to the structure which comprises of your non-keratinized epithelium. In this we have the first structure is lip. The lip is comprised of the outer skin which is continuous with the skin, and it is keratinized stratified squamous epithelium with adnexal skin structures like we have hair follicle, we have sebaceous gland. Then we have oral mucosa, which is a moist lining which is covered by non-keratinized stratified squamous epithelium, and this epithelium is associated with the presence of serous and mucous glands. Also there can be presence of muscles also, and there is a transition zone in between the skin and the oral mucosa. This zone is known as vermilion zone or transition zone or vermilion border. So we have to keep in mind that in the histology of lip, we have three areas. One is continuous with the skin, the second is continuous with the oral mucosa, and there is a transition zone in between that is known as your vermilion zone. This vermilion zone has a thin keratinized epithelium and it does not contain any skin structure such as your hair follicles. But sometimes there may be presence of sebaceous gland. So this zone is known as vermilion zone, vermilion border, and transitional zone. So when we see the histology in the skin of the lip, we can appreciate that there are presence of sweat glands, there are presence of sebaceous glands, and also there is presence of hair follicles. All these are adnexal skin structures which can be appreciated in the histology of the lip, which is continuous with the skin. Whereas in the area of the vermilion zone, we can appreciate that there is thin keratinized epithelium, there are presence of muscle bundles, and some kind of sebaceous glands can be present. So in the histology of lip, there is a vermilion border which is basically a junction between the skin and the mucous membrane. So whenever you see the histology, you can appreciate that on the one side there will be the epithelium of the skin, on the other side there will be epithelium of the oral cavity. In between there is a zone which comprises of the presence of serous and the mucous glands. Also there can be sometimes presence of sebaceous glands. The other structure which is lined by the non-keratinized stratified squamous epithelium is your labial and the buccal mucosa. We can differentiate the labial mucosa and the buccal mucosa because the epithelium of the labial mucosa will be thin and there will be rich vascularity and there is less amount of the muscle bundles in the submucosa. Whereas when you see the histology of buccal mucosa, it is non-keratinized stratified squamous in nature and it has some melanin pigmentation, melanocytes in the basal layer. Also, there will be presence of the muscle bundles in the submucosa. So, the submucosal layer will comprise of thin muscles and also there will be dense collagen bundles. Also, sometimes in the buccal mucosa, you can appreciate presence of ectopic sebaceous glands. These are known as podaceous granules and podaceous spores. So this is not a pathology. It is just an ectopic placement of your sebaceous glands, which can be appreciated in the buccal mucosa, and these are known as podaceous granules. So when we see the histology of the buccal mucosa, it is non-keratinized, stratified squamous in nature. Also, you can appreciate in the connective tissue, there is a dense connective tissue, dense collagen bundles in the lamina propria, and in the submucosa, you can appreciate the presence of minor salivary glands, also the presence of muscle bundles. The other structure which comprises of non-keratinized stratified squamous epithelium is your vestibular fornix and your alveolar mucosa. The mucosa is loosely connected to the underlying structures so that the movements are possible, and this is thin epithelium and is loosely attached to the submucosa. There can be presence of loose connective tissue. Also, sometimes there can be presence of serous and mucous glands as well. The other structure which is seen in the oral cavity to be non-keratinized is the inferior surface of the tongue, that is the ventral surface of tongue and the floor of mouth. In this, the mucous membrane is thin. The papillae of the connective tissue are numerous and they are short. However, when we see the histology of hard palate and gingiva, we can appreciate long, narrow, elongated pegs in cases of gingiva and broad, irregular pegs in cases of hard palate. Whereas in cases of tongue and floor of mouth, the papillae will be numerous and they will be short. So the epithelium will be non-keratinized, stratified squamous in nature. The lamina propria is loosely arranged. The submucosa shows presence of minor salivary gland and there are no muscle bundles seen in the floor of mouth. Also, sometimes in the histology of floor of mouth, we can appreciate the presence of adipose tissue, which is seen in the submucosa. When we see the ventral surface of the ventral surface of the tongue is non-keratinized stratified squamous in nature. However, in the connective tissue stroma, we can appreciate the dense muscle bundles. So we can differentiate the histology of tongue from the floor of mouth. In the floor of mouth, we can appreciate presence of numerous minor salivary gland, whereas in cases of tongue, we can appreciate presence of dense muscle bundles. This is the histopathological presentation of ventral surface of tongue, in which we can see that the epithelium is supported by dense bundles of collagen fiber, and in the deeper stroma we can appreciate the dense muscle bundles which are smooth and relatively thin. Now coming on to the histopathology of soft palate, it is stratified squamous in nature, but it is non-keratinized. When we see, it is highly vascularized and it is reddish in color. The papillae are short and few, whereas in cases of tongue and floor of mouth, the papillae were short, but they were numerous. The lamina propria shows presence of elastic fibers, and also the soft palate contains taste bud. But when we see the soft palate, it is continuous with the on the one side, it is continuous with the oral mucosal lining. However, it is then replaced by the epithelium of the nasal mucosa. So the soft palate is non-keratinized stratified squamous in nature, but the site where it is continuous with the nasal mucosa, it shows pseudo-stratified ciliated columnar epithelium. So to summarize, in the non-keratinized epithelium, it is seen in cases of lining mucosa. It is thicker in comparison to the keratinized epithelium. It has smooth interface with the connective tissue. And the layers which are seen in the non-keratinized epithelium are the stratum basal or the basal layer, stratum intermedium or the intermediate layer, stratum superficial or the superficial layer. This is the histological presentation of keratinized and the non-keratinized epithelium in a schematic diagram, in which in the keratinized epithelium we can appreciate 4 layers: basal layer, prickle cell layer, granular layer and the keratinized layer, whereas in cases of non-keratinized it is basal layer, intermediate layer and the superficial layer. So you have to attempt the MCQs and write the answers in the comment box. Thank you.